Welcome, and thank you for joining us again for the Idaho Falls Community Luncheon and their broadcast of our Rotary Club meeting. I'm Michael Blennis, and I'm the current president of the Idaho Falls Rotary Club. And we've got a great program again this week. But to kick us off, I always like to start off and just take a minute or two and talk a little bit about Rotary and a Rotary thought for today. And so as I wind down my presidency of our Rotary Club and the new president takes over in July, I just wanted to thank all the Rotarians for their continued support of Rotary and the Rotary Foundation. By being a member of Rotary, your help is helping us change lives around the world. Did you know that our foundation funded more than 1,400 global grants totaling over $86 million this last year? Or that together with our partners, we've immunized more than 2.5 billion children against polio since 1988. As a Rotary member, you make doing good in the world possible. Your gifts to our foundation help us address some of the most challenging needs in communities close to home and around the world. Most recently, Rotary has been responding to the COVID-19 pandemic with members working together to provide health professionals with protective equipment, feed essential workers, and care for others affected by the coronavirus. Because of your ongoing generosity, no challenge is too great for us. For that, I thank you, and together we will continue to change lives and to make the world a better place. I'd like to introduce Dana, our program chair for the month, who has been bringing in all sorts of great people this month who are helping make our lives better here in our local community. So with that, Dana.
Thank you, Mike. We have been so appreciative of Mike's leadership this year for our Rotary Club and feel sorry that we haven't been together during the last month of his leadership and look forward to celebrating him together in July when we meet together again. As was mentioned, our program today is focused on the hospitals in Idaho Falls and how COVID-19 has impacted them, their staff, and their operations. I appreciate the members of our panel being here today. These are all busy men, and we're fortunate that they were able to take some time out of their day to be with us and to share their knowledge and thoughts about what we felt like was a very interesting and pertinent topic. So I will briefly introduce each of them, and then we'll move into the question and answer portion of our program. First, we have Jeff Sollis, who is the CEO of Eastern Idaho Regional Medical Center. Jeff was named CEO of IRMAC in January of 2018. His appointment follows 4 years of service as the hospital's COO. Currently, Jeff is charged with providing leadership for the overall hospital operations and develops the short and long-term strategies to better meet the healthcare needs of our community. Prior to joining the IRMAC leadership team, Jeff served as the Chief Operating Officer at Timpanogos Regional Hospital in Orem, Utah. He was also the Assistant COO at HCA Wesley Medical Center in Wichita, Kansas, and the Assistant Administrator at HCA North Suburban Medical Center in Thornton, Colorado. Jeff earned his Master of Health Administration from Virginia Commonwealth University and a BA in Behavioral Science and Health from the University of Utah. Next, we have Casey Jackman, who is the COO of Idaho Falls Community Hospital. Casey is an Idaho native. He was born in Idaho Falls and then transplanted to Burley at a young age. He attended San Diego State and Idaho State University, graduating in radiographic science. He then embarked in a varied career that included MRI, CT, and nuclear medicine technology. He helped merge Bannock Regional and Pocatello Regional Hospitals into Portneuf Medical Center before moving to Boise to manage an outpatient imaging center. He met some leaders at Mountain View Hospital in 2007 and started there as the manager of radiology. His positions have evolved since into a director overseeing a wide variety of projects, and 12 years later, he has had the distinct pleasure of opening Idaho Falls Community Hospital. He now serves as the Chief Operating Officer of that facility. And last, we have Ned Hillyard, the CCO of both Mountain View Hospital and Idaho Falls Community Hospital. And CCO stands for the Chief Clinical and Compliance Officer. Ned has worked in healthcare for 32 years in a variety of positions and for several large healthcare systems across the country, from Grady Medical Center facility in Georgia to the Iowa Methodist Medical Center in Des Moines and Intermountain Healthcare in Utah. Ned has earned a variety of degrees. He has a biochemistry degree from Utah State University, a bachelor's degree in respiratory care from Loma Linda in California, a master's degree in statistical psychology from Georgia Tech, and a doctorate of philosophy in health science from Stanton Hall in New Jersey. He came to Idaho Falls in 2005 to assist Mountain View Hospital with hospital-wide system changes at the request of the board of directors, fell in love with this area and the people of Idaho Falls, and has been a proud member of our community ever since. I don't know that I've ever said that many medical terms or degrees, so thank you for your patience as I worked my way through that. Overall, these are such impressive men, and I just genuinely feel grateful that they are part of our community and for what they have done and what they offer for the betterment of our residents. So let's start with our questions today, and we'll move in order from Jeff to Casey to Ned as we do each question. So first, will you provide a brief overview of the state of operations at your facility? How have things changed even in this last month as we've seen an increase in cases versus perhaps in March, April, or May? Jeff?
Yes, as opposed to the initial stages of the pandemic, we've had to, like every other business, think about how to get back to some state of normalcy, knowing that it's not going to be completely like it was before. We're really focused on not just treating COVID-19 patients, but also focused on doing everything we can to treat all other kinds of patients that have delayed care for perhaps weeks, maybe even months. And so our focus has shifted from really solely being based on preparations for a potential surge in COVID-19 patients to preparing ourselves and doing everything we can to keep patients, family members, and staff safe as we treat all patients.
Thank you, Jeff. Casey?
Idaho Falls Community Hospital opened 205 days ago, and it's an evolutionary process. So getting back to normal is not something that we're even striving for, because we're still going through that evolution. We've worked really hard to not only take care of the patients that have come through our emergency room and the COVID patients, but to be able to evolve our processes that we had planned as we opened. So we've been focusing on that quite a bit during this time.
Thank you, Casey. And Ned?
Mountain View's approach has been, like Jeff brought up, is a concern to manage those patients with COVID, or to bring education or to help manage the fear mechanisms surrounding COVID by education and also by supporting our community with those things. Although the initial impact didn't impact our community, like the exposure, but the stay home thing affected our clinics substantially. But the thing is Mountain View, we just tried to prepare for and evolve with our community's needs, and support not only our community but our employees as well during this evolution.
Thank you. Both Ned and Casey said evolution. So when we talk about the safety protocols that have been established at the hospitals, how many of those protocols were in place before COVID, and how many were created or instigated because of COVID? Jeff?
We treat patients with respiratory illnesses all the time at ERMAC, and it's always a matter of focus for us to protect our patients and our staff, and using appropriate PPE. PPE isn't new. It wasn't something that was started with COVID-19 patients. It's something that we've been using for many, many decades. And I would say in terms of things that have changed, we've really focused on trying to follow the guidance of the CDC. As everyone knows, COVID-19 is a new virus that scientists and physicians are still trying to fully understand, and the research continues to evolve. And so we have leaned on national experts to give us guidance in terms of how we appropriately protect staff and patients. For example, at ERMAC, we have a universal protocol for masking. And so whether you're a visitor coming to the hospital, a patient, or a staff member, everyone inside the four walls of ERMAC is masked. Everyone that comes to ERMAC has to be screened. And so we're asking screening questions related to potential exposure to COVID-19. We're also doing temperature checks to make sure that you're not febrile before you enter the facility. We're limiting the number of visitors that come into the facility. So still at ERMAC, we are only allowing one visitor per patient. And just to pause on that for a second, I know that can be somewhat frustrating to loved ones that really want to see family members in the hospital, but we're not just trying to protect the patient, not just trying to protect our visitors, we're also trying to protect our staff. And we know that as the region's tertiary referral center, many communities rely on ERMAC. And if we don't have enough staff to take care of patients, i.e. if staff have been exposed and potentially that takes them out of the workplace, then that puts us in a compromised position where we're no longer able to take care of potential patients that might come to us. So lots of focus on trying to restrict visitation to prevent unnecessary exposure. We obviously all try to encourage social distancing. For example, meetings that we are accustomed to having at ERMAC that historically have had certainly 10 or more people. We've put a stop to that for the time being. I think everybody across the board, no matter what industry you're in, have become very familiar with WebEx and Zoom conferences, and that's something that we've done at our facility as well to just try and limit the potential exposure to this virus.
Thank you, Jeff. Casey, can you address safety protocols at IFCH?
Sure. Every hospital practices universal precautions. When you have somebody come into your hospital with an unknown disease, you spend a little bit of time diagnosing that person and diagnosing the disease, and you don't really know the contamination or the potential to catch that disease. And so you practice universal precautions. I think what we've seen change a lot as the pandemic started was the utilization of the advanced PPE. And luckily we had quite a bit of that, but you can never be prepared when you don't know what's coming down the road. And so acquiring some of that additional PPE was interesting, and utilizing that to keep the staff safe. And probably the other biggest change, as Jeff alluded to, is keeping the staff and the patients and the general public safe with social distancing and reducing visitation. Usually when somebody's recuperating from surgery or from an illness, they want to have their family members around them, and having to limit that has been a little bit of a challenge and a frustration for family members, but that is something that we've had to employ and pursue, and we have the same visitation policy as ERMAC, as one designated visitor, and it's frustrating at times because people want to be with their loved ones as they recuperate, but it is for the safety of all those people involved.
Thank you, Casey. Ned?
We changed, just like the other hospitals have. We limited our visitor exposure, but it brought into the safety protocols, like you addressed, is supplies and also knowledge of how to use proper PPE. And I cannot emphasize enough about education regarding hand washing, containments, cleaning, creating an environment that is clean and safe for that patient interaction to occur. And it's like Casey said, sometimes this can be an intrusion in the hospital experience with the family, and that is a vital support to our patients. And we recognize that where we have a growing and ever so developing labor and delivery experience, that's hard for those family members to miss that experience. We've implemented a FaceTime component where the loved ones may sit in the lobby and observe and talk to mom while she's participating in that delivery and to be still part of that, but still create a safe for not only our employees, but for our patients as well. It's a difficult thing to do, but you still want to take care of every aspect of a patient and our community's needs.
Thank you, Ned. A few of you talked about PPE, so I want to jump down a question and talk about that. For those of us not in the healthcare world, can you explain the process of how healthcare facilities obtain PPE supplies, and then how do you conserve them and properly manage the usage of those supplies? Jeff?
Yes, so ERMAC is part of the nation's largest hospital company, HCA Healthcare, and HCA actually manages the nation's largest group purchasing organization or supply chain entity. And fortunately, that puts us in a position where we're able to obtain adequate supplies of PPE. So that's going to be gloves, that's going to be gowns, that's going to be masks, it's going to be face shields. And as I said, we have adequate supply, and we obtain those supplies through our supply chain. In terms of how we, I guess, manage that PPE, we have to look into the future and consider what might come. We don't know if there will be another surge of COVID-19. There is some speculation that we'll see a surge in the fall. No one really knows, but we have to plan for it. And so we consider what that might look like and how much PPE might be used in another surge. Fortunately, here in Idaho, we've not seen the kind of volume of COVID patients that need to be hospitalized, and that's really where you burn up a lot of your PPE supplies. But we're planning for that. We have to plan for that. And so we've been very judicious about how we use PPE, while also focusing on making sure, again, that our patients, our staff, and visitors are appropriately protected. So we're not holding back PPE in a way that might compromise the safety of any of our staff or any of our visitors and patients, but we are being careful about conserving it.
Thank you. Casey?
That is the problem, is making sure that you have enough of that protective equipment. And we went from hospital workers using masks and gloves to entire populations wanting to protect themselves with masks and gloves. And so there's always a shortage of some kind of piece of equipment throughout the United States. And then to have that influx of people wanting to use that kind of equipment really did cause, kind of a shortage and did make things difficult. We had a lot of people working for us to try and look outside of our GPO to be able to purchase that protective equipment, and purchasing from other countries and seeing what we could do. We also found that we had to find ways to sometimes try and safely prolong the use of some of that equipment, and working with some of our vendors as they were scrambling to find ways to clean that equipment and keep it safe for people to use. Now, obviously, if it becomes soiled or contaminated, you can't keep using that kind of stuff. But your regular masks, you'll see people who used to use a mask for every interaction and then dispose of it. And it got to the point where, at times people are having to use that mask throughout the day, where I don't provide patient care. I'm in that classification where I'll wear a mask all day long just to protect our inventory. So it's been an interesting experience.
Thank you. Ned?
Well, to speak to PPE, I don't know, it stands for, of course, personal protective equipment. And it ranges from a simple mask, which is you see with the ear loops, to the personal homemade mask, which you've seen made that will be just a cloth type material that some people will purchase and things like that, where it goes to the N95s, which are tight and they're sealed to the face. And those are for a direct exposure with a patient that is symptomatic. And then it, of course, escalates to PAPRs. And then Casey talked a little bit about face shields. I do want to pause during this time. and talk a little bit about our community. We have a Chinese community here, which during this time of shortage, when we were trying to get our supplies back up, came and donated a significant amount of masks that they had raised by themselves and to purchase, and they've gathered up and they gave it to, I believe, all three of our hospitals. That is to get that support from our community, like Casey said, during the shortage of when we were scrambling a little bit for our PPE equipment, was very heartfelt. It meant a lot to us to have our community support us during this time, because we do want to protect everyone as best we can at all times. And it does consume a fair amount of equipment, and you do go through, like Jeff commented, a burn rate that can be worrisome. But like I said, with the community support and also with the knowledge we have, it's going a lot better.
Thank you, Ned. That's wonderful to hear. I hadn't known of that particular donation, and we'll talk about some community support aspects later. But while we're talking about resources, moving beyond PPE, I was reading an article, and it made me curious to ask what considerations have emerged around other resources and where they're sourced from. So, for example, items ranging from the food that you use in your cafeterias to gas or oxygen supplies. If access is limited due to our rural nature and high demand in other areas, how has the planning and obtaining of all of your resources changed? Jeff?
Fortunately, we haven't been in a position where we've seen a huge shortage of other supplies. I would say early on, like regular everyday citizens, we ran into a shortage of toilet paper, and so did everything we could and got a little bit resourceful in procuring more toilet paper. But outside of that, in terms of food and other supplies that you mentioned, Dana, we've been fortunate, again, through our supply chain to be able to procure all those items and been in a good position.
Thank you. Casey?
I would agree. I think we found creative ways to not only acquire but protect and monitor our burn rates on our resources. I think the most valuable resource that we had that we needed to protect was our staff, and we saw a lot of changes in how we would have our staff interact with the rest of the world. You saw a lot of people cancel vacations. You saw a lot of people that had to make modifications to their lives. And a lot of people ended up having to stay home to protect themselves and to protect everybody else at the hospital when natural life events happened, like having to go pick up a missionary down in Salt Lake would actually require that person to stay home and quarantine for a little while. So I think that resource probably invoked the most imagination in trying to protect that.
Thank you. That's very interesting. Ned?
We haven't really seen a fight for supplies other than, of course, for the PPE. But I mean, our supply chains are very well established and really haven't had that big of issue other than, like Casey mentioned, about staff members traveling and possible exposures, and then you have to be cautious and rule them out, which inherently brings a shortage. But that's the only thing that we've seen change with the supplies.
Wonderful. That's good to know. Thank you. We've had a few groups here in our Rotary Luncheon meetings talk about testing from the health district's perspective to some of the government or private entities. So from a hospital perspective, who are the parties involved and what is the reporting process for a patient that tests positive for COVID-19? Jeff?
Yes, we have a really organized approach to identifying any potential patient that might have COVID-19. So, and when a patient comes into the hospital just with respiratory symptoms, not knowing if they actually have the virus, we treat them as if they do have the virus with all the appropriate precautions. And essentially, they're put on a list that our infection prevention nurse manages, and we keep track of them throughout their stay. Obviously, as the test results come back, we make sure that those results get back to the patient as quickly as possible. So if a patient is diagnosed with COVID-19, our infection prevention nurse first notifies the physician that's managing the care of the patient, and the physician then notifies the patient. Shortly after that, or perhaps coinciding with that communication, we reach out to the local health department to make sure that they're made aware. And the health department has to be informed for lots of reasons, but primarily to begin to conduct a potential investigation, a tracing investigation, to be able to track the origin of where they perhaps were exposed to COVID-19 so that they can go into action and do what they have to do to communicate with appropriate persons to make sure that they that may have been exposed to that patient, that they are self-quarantining, staying at home, self-isolating, so that there's not further spread in the community. So it's really an organized, coordinated effort, and I think it has worked really well. We're in constant communication with the health department, and they've done a fine job of making sure that communication is flowing throughout our community to those people that need to know that perhaps were exposed to a patient that tests positive for COVID-19.
Thank you, Jeff. Casey and Ned, perhaps the answer doesn't change much for your facility, but do you have anything to add, Casey?
No, I echo what Jeff said. We've worked really closely with Eastern Idaho Public Health. When we find a positive COVID case, or we're actually treating a patient who was diagnosed positive, the public health's been really good to not only monitor that, but we do report to them daily on a lot of different statistics out of our hospital that they're using to track the advancement, even if it's slow, of COVID through our community. So it's good to have such a good organized facility like that in our area. They have done a fantastic job, and they've been really good to work with.
Thank you, Casey. I agree. Ned?
We have a lot of clinics, about 42 or 43 clinics from Madison, from Rexburg area, all the way down to Pocatello. And being able to gather those data that maybe doesn't make it to the hospital, but makes it to somebody that is positive. Like we all know, the problem with this COVID-19, other than, of course, the complications to human life, but it is the spread is so difficult because the host is, if you will, so healthy, can transmit it so well as they go from place to place and not even being aware that they even have anything. Of course, we do, you can do AGG testing, which is the antibody testing, and you can do a PCR testing, which is the virus sloughing testing in the back of the throat, the swab in the back of the throat. But it is difficult to manage because some hosts, like I said, are non-symptomatic. So what we've been doing is reporting, like Jeff commented, that somebody that does come in with respiratory illnesses or respiratory responses, and we do track them even down to the granular level of the clinics and to watch what happens there so that our local government can see kind of what is going on with the positives and stuff like that, testing.
Great, thank you. How does your facility communicate? So we, I think, know a lot of your public information officers or outreach personnel, but how do you communicate with patients as a whole, with your staff, with local government organizations or other organizations in the community? Jeff?
Yes, I don't know if everybody knows this, but when we have any sort of crisis that we're having to manage here in the community that affects healthcare or the hospital, we always set up a hospital incident command center, and part of that incident command center includes communication. It's a big part of incident command. And so, you know, from the very early stages, we had our communications officer that was working with our local health district, our public health district, our EMS community, city government, to ensure that communication was flowing, information was being shared, and that's reciprocal. So information comes both from us and gets back to us from all those different entities. In terms of internal communication, we have made it a daily exercise to make sure that we're reaching out to our leadership team and the entire staff of the hospital, as well as our medical staff on a really regular basis, medical staff, maybe not daily, but almost daily, just to make sure that they're aware of the current status of our pandemic response. And before any communication goes out, and this is part of the incident command's function, I'm part of the process of approving that communication to ensure that the communication is accurate, that we're not overlapping communication, there's no misunderstandings or miscommunications that occur. And by controlling that communication, making sure it comes from one source daily, we can avoid a lot of confusion. In terms of the public, we've tried very hard to use our social media platforms to inform the public, keep them up to speed on what's going on. We've also used local media outlets to communicate. Every tool that's at our disposal we've tried to use, and we've been very appreciative of local media in that effort.
Thank you, Jeff. Casey?
We've used a lot of the same avenues. I think one of the most important things we've done, and I don't want to steal any of Ned's thunder, but we've worked really closely with the physicians at Idaho Falls Community Hospital and at Mountain View Hospital, working together to make sure that we're sending out a unified message, not only to the community, but to our staff. And also pulling together those resources to make sure that that we're as prepared as we possibly can be, and that we're sending out a unified message to our staff so we're all on the same page. A lot of the communication that we push forward with the physicians is incredibly important, because they're pursuing all of the advancements that are trying to be made as this pandemic develops, and new drugs or old drugs are proposed as a treatment. And so being able to communicate that with the physicians to our staff, I think was incredibly important, and being able to work with the physicians at Mountain View and Idaho Falls Community Hospital together was incredibly helpful, and made sure that we were putting out the right message.
Thank you. Ned?
We did, of course, participated with IFCH in our medical staff COVID committees. And the medical staff COVID committee, there's one committee that's comprised of just the medical staff. We believe they are the experts. They know medicine better than anybody else, and they gave us some good guidance on policies, on how we behave, and how we communicate out to a general common thought process. We have some really good infectious disease docs on our staff that were active and participated with us in many of our communications and things like that, to make sure that what we said was true and what we said. But as far as the facilities communicating is, I just usually call Casey and talk to him, or we can text Jeff and always talk to him directly. The hospitals communicate, I think, very well and work together because we are focused on this community.
That's great. Thank you, Ned. Moving to a different topic, I think few people would have predicted at the onset of the pandemic the opposite economic effect that it had on rural hospitals. So it's been devastating to many, and we're going to talk in the next question about federal financial aid. But in general, how have those losses been absorbed or mitigated at your facility? Jeff?
Yeah, I'm not sure that the general public knows how hospitals have really been negatively impacted, just as most businesses have been negatively impacted through this pandemic. So at IRMAC, we've seen, through the month of April, we saw probably our sharpest declines in volume and associated revenue that typically comes to the hospital, close to 40% declines in volume. And that kind of runs the spectrum from ER volume to surgical volume. Also probably less known is that most of, or I should say, the economic engine of hospitals is always the operating room suites. And so when we see a majority of our patients coming in that are truly medical patients, not surgical patients, there's also a decline in revenue. So 40% decline in revenue obviously has a tremendous impact on a facility. You have a cost structure that has been built over many years that is meant to support the volume that typically comes into the hospital. And so our primary concern through all of this has been our staff. And fortunately, we've been in a position where we've not had to furlough any staff, we've not had to lay off any staff. Instead, as a company, the HCA Healthcare company that we're a part of, we've made the decision to actually offer pandemic pay. So all of our employees, even if they have been called off of work because there's not enough patients to take care of to support all the workers that are typically in our hospital, they have been made whole through pandemic pay or nearly whole. What that means is that they've been able to keep all their PTO, use some of that PTO if need be, but also have been supplemented by pandemic pay so that their paycheck that supports their families remains whole. Obviously, we hope that doesn't go on forever. That's been a huge investment on the hospital's part to retain our staff and show our appreciation for them. But that's just one way that we've, I guess, reacted to this decline in volume and revenue.
Thank you, Jeff. Casey?
Yeah, the staff definitely is a resource that takes a bit of money, and we did experience a little bit of a drop in our numbers too. But as I mentioned in the first question, is we're still undergoing the evolutionary process, and so staffing creatively has been something that we've been doing since day one. We have been looking for ways to utilize the staff possibly in different areas where there is a greater need, offering opportunities to be able to cross-train into areas where they can utilize the skills that they have, maybe in a different setting, and working that way to try and maintain the staff. We also are very happy that we didn't have to furlough anybody or lay anybody off. It was scary though, because if this would have lasted much longer, and it's still going on, but if the impact would have maintained where it was in April and early May, it could have been a lot harder for our hospital to maintain any kind of growth from a startup phase. So it did require some creative staffing. One of the things that we wanted to do though, there is a nursing shortage in the United States anyway, and I would have loved if we would have been able to find enough nurses locally to be able to staff our hospital. But as we opened up to be able to find some of the specialty nurses, we did have to hire some travelers and bring them in to help us handle the volume that we were seeing as we grew. We have worked very hard to try and eliminate the use of those travelers and to facilitate the use of the staff that we already have, because we'd rather invest in them than invest in somebody who's only going to be here for a certain amount of time. So creatively using that staff has definitely been a tool that we've used quite a bit in the last little while.
Thank you. Ned?
It is difficult during, you see those downturns of 40% as we did as well in our clinics and in our facilities and things like that. It's difficult to, of course, maintain staff readiness and also maintain staff so that as you prepare for a grower volume that may occur, like Jeff commented about the pandemic escalating and being able to have staff still available to participate. At our hospital, we put together a Mountain View charity, and it's run by an independent board and independent of Mountain View. But we were amazed at the physicians that donated money to the organizations to help our employees that were affected by COVID, that just because of they were called off because of lack of volume and things like that, and they went through some financial difficult times. And we want to support our employees as best we can so that they can continue to practice and be there when we need them. And so it was amazing to see the involvement or the willing to sacrifice, or those physicians and providers that participated in that was magnificent. And so, I mean, it is good to watch that. But that was a big issue, and that was really scary because it was strapped right to it. Yep.
Thank you. What federal financial aid has been available to hospitals, and have Idaho Falls facilities benefited from that? Jeff?
So, as I said earlier, ERMAC is part of HCA Healthcare, and we will be receiving some aid money through the CARES Act that will eventually come to ERMAC through our parent company. So we're very grateful for that help. As I mentioned, seeing a 40% decline obviously has a real impact to the bottom line. And so that will help us, again, to retain staff and keep our facility ready for anything that might come in the future. So we're grateful for the aid. Still waiting for it to arrive, but really feel like we're in a blessed position to even receive it.
Thank you, Jeff. Casey?
Unfortunately, a lot of the aid that's available out there is based on a comparative for your prior year. We don't have a comparative for our prior year. We weren't in business a year ago. So the opportunity for Idaho Falls Community Hospital to pick up some of the financial aid that's available through the federal government doesn't exist for us. And so we're having to find other avenues to pursue.
Thank you. Ned?
We did receive ours, and it was a blessing that it kept us going, and it was very much appreciative at a time we needed it. It's hard when a hospital that supports community goes out of business. That's a scary time for not only our community but for the entity itself. But it was vitally needed, and it was fantastic that we got it.
Thank you. Thank you all for being so transparent with that answer. And this may be a naive question, but are Idaho Falls hospitals or local hospitals members of larger associations that help influence discussions or decisions at state or federal levels? Jeff?
Yes, we are, and we're fortunate in the state of Idaho to have the Idaho Hospital Association. That's a very well-run organization led by Brian Whitlock, who is the president of that group. And the Idaho Hospital Association has been very active in the pandemic response. And fortunately, Brian and his team work hand in hand with the governor's office. And so it's really provided us an avenue to provide feedback based on the actions, based on the information, all the things we're seeing here on the ground here in Idaho Falls, to inform the governor, to help him in his decision making. I think that the feedback that was given on this side of the state from hospital leaders to the IHA was definitely heard by the governor's office and was factored in to the response around Rebound Idaho. And again, we've been in a fortunate position here in Southeast Idaho where we haven't seen the kind of numbers that many other states have seen around COVID-19. And that's enabled us to really get back to work a lot faster. And the economic impacts, while certainly not small here in Idaho and have impacted many, many businesses in a really negative way, when compared to other states, we are in a better position. And I think part of that is the communication that's flowing through local leaders, our public health district, that then flows to the governor's office that helps with this decision making.
Thank you. Casey?
Yeah, I agree. Belonging to the Idaho Hospital Association is definitely a security blanket that we've enjoyed. I think they speak very well for the hospitals in this area, and they understand the need for large tertiary facilities such as Jeff's, down to the small hospitals in our outlying areas, and I think that was very beneficial for us. We also have some very impassioned leaders from this area. We had the opportunity to meet Senator Risch during our grand opening, and his office was very good to keep reaching out to us and checking to see if there was something that they could do from their level. And so I think having caring leaders in our area that were concerned and wanted to make sure that we had the resources that we needed to be able to handle whatever walked through our door was very helpful.
Thank you. Ned?
I mean, just echo what Casey said. We did the same. We acted as together in that response, and I cannot tell you how much support we've got from our governor, and Idaho's just a great state. I mean, they've just really been there for us, and we've been able to talk with him one-on-one and have some good conversations and express our concerns. I feel like Idaho much understands their hospitals, understands the value, and I think all three of us cherish that relationship and allows to facilitate camaraderie and a focused community care focus.
Thank you. A lot of what you have said today, I think, can add a measure of confidence to people who are wanting to book procedures or visits to the hospital. But we've heard a lot that patients are feeling hesitant to do so. So what would you say to those patients who may be putting off a standard visit or a procedure about their level of confidence in coming back to the hospital? Jeff?
I would say don't fear seeking health care when it's needed. It's safe to receive care at URMAC. In fact, in some instances, it's dangerous to delay health care and the consequences can be life-threatening. At URMAC, everyone is masked. URMAC requires everyone to have a temperature check before they enter. URMAC follows CDC protocols for disinfection. URMAC follows CDC protocols for caregiver PPE use. URMAC isolates all COVID-19 patients or those awaiting tests for COVID-19 in the facility so they're not mixed in with the generalized patient population. To date at URMAC, we've treated 16 COVID-19 patients on an inpatient basis. In comparison, we've treated over 1,000 patients with other healthcare needs. It's safe to receive healthcare at URMAC. We are doing everything we possibly can to ensure that that happens for our patients and our staff. So I would say seek health care when it's needed.
Thank you, Jeff. Casey?
Absolutely. Look, this was a scary time, and a lot of us have never seen a response like this where the government is actually asking you to stay at home and discouraging you from participating in a normal lifestyle. And what we saw was a lot of people that have chronic conditions, ongoing illnesses that need treatment. A lot of them, unfortunately, were scared into a position where they didn't seek regular health care. And so when it progressed to the point where they needed to come to the hospital, they were often a lot sicker than they needed to be. Completely unrelated to COVID. And that's an unfortunate thing. And we did see a lot of people that were very, very sick. And probably, had they sought out their normal health care, wouldn't have needed to be hospitalized. And so we do encourage people to not only keep up with their regular medical care, but not wait if they notice something new. To be seen. Jeff's right. At the hospital, we treat a lot of other illnesses besides COVID, and we're still treating those, and we're advancing the care that we want to give at Idaho Falls Community Hospital from when we opened 205 days ago. Those hospitals always treat a multitude of diseases, and just because this one is serious, and it is serious. The people that have been affected with COVID-19, unfortunately, have been incredibly sick. But during our normal operations, we treat all kinds of bad diseases, and we do so safely, where we maintain that exposure. We protect our staff, we protect our visitors, we protect the patients that are also in the hospital at the same time. So I would strongly encourage people not to put off health care because the ramifications of waiting when you shouldn't can be life-threatening.
Thank you. Ned, anything to add?
Well, when you go to select your hospital, and of course you come down to the time you're going to have surgery, elective surgery, or emergency can be thrust upon you. But the thing is you need to realize is take the proper precautions. Are all these hospitals, we screen, everybody takes their temperature, and we mask and we monitor and we do those things. But it can help substantially if the patient, in preparatory to coming to the hospital, if it's not emergent, that they do quarantine, they do limit their exposure, they limit their exposure to possible COVID patients, they limit their travel. And so it gets them in a preparatory state for coming to the hospital and making sure that they don't, because remember, it's 5 days. Usually it's customary 1 or 2 there after your exposure that you show symptoms. So limit that. It will help. It helps substantially because we are doing everything we can, create an environment for you to have healthcare in a safe environment. But I encourage our patients to do the same thing, is prepare the right way. Talk with your provider about questions or concerns you might have. He or she can answer those, or we can get them directly to our facilities. Just communicate. That is the vital to this thing being successful and to eliminating fear.
Thank you. We're going to end with a few last questions. I'm always curious to see different leadership styles and to witness you all during times like this. And I know that hard decisions have been made, and I admire you for what you've been able to do. How has your personal leadership style changed throughout the course of the pandemic, Jeff?
I'm not sure that my leadership style has changed a lot. For those that know me and have worked with me, know that I have a really calm demeanor. That's just who I am. It's the way I came to this earth. And I am a really kind of a consensus-building, collaborative leader. And so I've used that leadership style throughout this pandemic response. For example, I put together with our chief nursing officer our COVID-19 physician advisory council. We met early on daily. We're meeting less frequently now, but it is a regularly occurring meeting to gather input, to gather insight from our medical staff to ensure that I'm seeing all the angles and that we're putting together the best possible plan to respond to this pandemic. I would say if anything's changed, it's just been a change of focus. We always have challenges in a hospital environment. There are business challenges, there are clinical challenges that we have to rise up to all the time. And this is just the latest challenge that we've had to rise to and to make sure that we're giving our very best to the community and to the region.
Thank you, Jeff. Casey?
I can't see much of a change in my leadership style from before the pandemic to now, other than I've become a little bit more of a cheerleader. It's caused a lot of uncertainty in healthcare. You see some hospitals that are completely overrun to the point where they're having to build makeshift facilities to care for people. And as all of us have mentioned, we were lucky in this area where we weren't hit that hard. But the economic impact does make people nervous. And so being a cheerleader for staff members that are worried about what's going to happen at the hospital, being a cheerleader for staff that are putting in really long hours wearing uncomfortable advanced PPE, taking care of somebody who's pretty sick, I think is probably the biggest change I've seen is I spend a little less time staring at spreadsheets and a little bit more time cheering my staff on and the physicians that are taking care of the patients, which actually I've kind of enjoyed. I like being that supportive role for the people who are on the front line.
Thank you. Ned?
The only thing I've changed is I'm methodical in my decision-making process, listening to other people's input, taking their perspective. I've always prided myself on that component, but one thing I've learned is not to overreact. You constantly see that when fear is in play. And the response is everybody wants something done right now. And you have to realize, does that need to be done right now? So it's allowed me to posture and to approach the problem with a solution with many input and a team approach. So I would say that just emphasized that component.
Thank you. And lastly, it's been moving to see both locally and nationally how hospital staff and administrators have been applauded and recognized. So if you could jointly answer kind of how have you done that within your hospital, or what you've seen from the community, and then also what can we do to support you? What can we as Rotary members and as community members do to support the efforts of the hospital better? Jeff?
You know, I would just say that our community has been exceptionally generous, and you know, we've seen an outpouring of support. We've seen lots of different ways to demonstrate that support. I can think of lots of examples, but I'll just give you a couple. We've seen local restaurants that clearly have been in a compromised position, a difficult position themselves, sending meals to our facility to feed our staff, to show their support, which I think is incredibly touching. From that example to, I remember one evening, a local group showing up at our hospital in our parking lot, all in their own cars, so appropriately social distancing, but out in front of the facility, out in front of our ER, honking their horns, really in an effort to applaud our staff, to thank our staff. And I can tell you that that had great impact on all of us. I think, you know, internally, what perhaps some people don't think about is, you know, with many of our staff, our nurses, our workforce being in a position where their kids are no longer able to go to school, that's put them in a position where they've had to find childcare so they could come to the hospital and take care of patients. And so fortunately we have at IRMAC what we call the HCA Hope Fund, and all the executive team and many folks throughout the hospital donate to that fund on a regular basis. But this year we tried to be exceptionally generous and in donating portions of our salaries to help with our staff and their child care needs. So a lot of our staff received some aid through that Hope Fund so that they could come into the hospital and work and make sure their kids were taken care of throughout the day. Just a few examples, but we live in an awesome community that has been incredibly supportive.
Thank you, Jeff. Casey?
I completely agree. It's been humbling to watch people that are going through this and their businesses being affected be generous with us, and it's been good to see the staff recognized. We had an artist come by yesterday who did a little curbside concert, Alex Boyer, and he made a comment during that concert that it's unfortunate we had to go through this for people to realize that you're heroes. And the staff that have dedicated their lives have put themselves in a place where when they come home from a shift, you know, before they can spend time with their family, they feel like they need to, you know, disrobe and get those clothes in the washer and change and shower themselves before they can spend time with their family. It is kind of heroic that they would put themselves in that kind of a position to help take care of somebody. The community has been fabulous. A group from Holy Rosary School that raised money for the hospitals, a group of kids that actually took the time to make origami animals for the staff. It's been phenomenal. As far as what the community can do to support our hospitals, you guys have been doing it. I can't think of anything else that I would ask this community to do to help us, other than make sure that everybody's staying safe. Do what you can. COVID has not gone away, and it's not going to for a while. And so I think the best thing you can do to support the hospitals is do what you can to not put yourself or others at risk, you know, and follow the guidelines that are out there, the social distancing, wearing your masks when you're out in public. I think those are probably the most important things.
Thank you. Well said. Ned?
Our community's been amazing. I mean, the signs you see and the billboards, and then, you know, of course, Our staff just loved the Chick-fil-A thing where they gave that discount, and we went on and on about that. But that just meant a lot because, like Jeff said, they had a hard time too, but they stepped up, and those little tiny pushes, those micro pushes that constantly occur, those thank yous, those things, those recognitions, even so slight, it just inspires a workforce movement. It helps them feel valued and appreciated, and everyone likes that. And it means a lot to our organization, the community support that they've given Mountain View through this time. I cannot emphasize that enough.
Wonderful. Casey, Ned, Jeff, thank you so much for being here today. Thank you for taking the time out of your day to share with us. Thank you for what you said. I know that for me personally, I feel a measure of comfort knowing and just learning from you today, and I'm sure that you're all open to other questions that people may have as we go along. So thank you so much, and I'll turn the podium back over to Mike to close our program.
Well, thank you, Dana. What a great program, and I learned a lot. And just listening to our representatives from the hospital talk, and thinking about our hospital staff and our emergency staff, police, fire, EMS here locally, really are heroes throughout this pandemic. But I think we're also, what I heard is that we're all the foot soldiers in this together, supporting those heroes. And we need to take care of ourselves too. So it's time to get that physical. It's time to go see your doc if you've got something that's ailing you and get it taken care of, because this is a long battle. We have a lot to learn yet about the coronavirus and COVID-19 and the symptoms, and we need to all take care of ourselves. And we've got a great community here of medical professionals that are ready, willing, and able to take care of each and every one of us in our community. And so don't delay that health care that you might need or that preventative visit to your doctor, so that you can make sure that you don't have something creeping up on you that'll take you out of this long fight. With that, I'd just like to thank everybody for watching today, and to remind you that next week, Wednesday, we have another great program about the future of classroom education, where we're going to have some school superintendents coming in and talking about what that looks like in the future. And one of the most exciting parts of the program, is also going to be the announcement of our 6 Rotary Scholarship winners for this year. So thank you for tuning in, and stay safe, wear your mask, stay socially distanced, and we're adjourned.